everyone here is very, very enthusiastic about what they do for a living, and that is the kind of place where I would want to work, and that is also the kind of place where I would want to come as a patient. Anyone who goes into medicine has to have an intense desire to want to work directly with people. My wife is also a physician. She's a pediatrician, so I let her handle all the health issues regarding our three kids. Ultimately, coming to Pentucket Medical, my aspiration is to be able to focus as much of my time as possible to patient care, getting to know my patients as best I can, getting to know their families and their particular situations. So it's part of the clinician's role to read into an individual's personality and find a way to fix a health problem, or more preferably prevent a problem from occurring in the first place. A good day is when at the end of the day I can look back over my patient list and see that perhaps I've been able to make a small change in a couple of people's behaviors with regards to their overall health. I may have a 50-year-old male who's coming in for a blood pressure check, and he's a little frustrated because 5 years ago he was only on one medicine, now he's on two medicines, and it's still not under adequate control. And he's saying, is this my future? Every few years I'm going to have more and more medicines introduced. And sometimes you may realize, well, did you ever think about, beginning any kind of an exercise regimen? And that may never have been addressed before. And when you sit and tell them, or you tell an individual after a couple of minutes that participating in regular, physical, primarily aerobic activity may improve your blood pressure control and may down the road allow you to come off of some of these medications, but it's going to take a little bit of work on their part. They're thrilled to hear that. Essentially, what our role is to try to both inform our patients and also empower them to have greater control over their health condition. There is a special challenge with say older adults that it's even more essential that they have a primary care physician or a general internist who's kind of looking over their entire state of health, not just focusing on one specific issue. And part of that reason is because older individuals are probably on more medications. You have to be more concerned about any potential interactions, and that is one of your primary responsibilities, is to make sure that everyone is on the same page with regards to any treatment modalities that may be contemplated or initiated on an individual. Make sure that what helps with one problem may not be detrimental with regards to another component of health. My name is Dr. Aldo Damiani, and I am a general internist at Pentucket Medical.